Well, it's nice because I'm the only one in the entire state of South Dakota that did a specialized training fellowship in urogynecology, which is often referred to as female pelvic medicine and reconstructive surgery. What a urogynecologist deals with are women's issues as they relate to urinary issues such as incontinence or retentions or infections, or bowel issues such as constipation, or support to the pelvic floor such as prolapse, where parts of the women's reproductive organs can actually fall out of place. This specifically happens after birth, but it can also be damaged just with the aging process. So not only can women experience problems after pelvic floor injury from birth trauma, they can also develop issues of support as they get older. Female pelvic medicine and reconstructive surgery, or urogynecology, focuses around the support to a woman's pelvis. And there's a bowl of muscles that help support the different organs that are related to the urologic tract, such as the bladder and urethra, the reproductive organs, such as the vagina and the uterus, and then as well as for defecation as it relates to the rectum and anus. And all these areas can be damaged during childbirth, or they can develop problems later in life. And urogynecologists specialize not only in medical and muscle rehabilitation, but also the surgical management of these problems. And that's where our expert training and doing a fellowship has really come into importance to complement the other therapies that a urologist or a gynecologist or even a colorectal surgeon or a gastroenterologist might offer women. Most of the training becomes important for women, which is as the need for surgery arises, that you need expert training and education in the repair of incontinence and bowel dysfunction and prolapse as it affects women. I think this is what most women can relate to, happens to deal with the bladder issues. As young women, they face a lot of issues such as urgency frequency, related to pain with filling of their bladder, or most commonly is leakage during activities such as running or exercising, and that's related to having children. And there is a simple surgical correction for this, and that's the most common problem people see typically in their 20s, 30s, 40s, and even up into their 50s. As women age past beyond the age of 65, as they get into retirement, what becomes more problematic for women is a syndrome of overactive bladder, where they feel an urge to go to the bathroom and they can't make it to the bathroom in time. And there's both medical as well as invasive and minimally invasive surgical techniques to correct that depending on a woman's issues or complaints. And I think the important thing to grasp from urogynecology is these are functional problems. This is not life or death. This is not a cancer or a heart disease where if you don't treat, there is dire consequences. The aspect that urogynecologists want to function on is creating people to be able to live their life, do the activities they want to do, and it's managing those functional problems, which can be very debilitating, but raising awareness there are simple treatments that can really help women gain more independence. I think what people need to help them understand the need for someone as specialized as a urogynecologist is what in their lifestyle is preventing them from doing the things they like to do. Are they having trouble with incontinence, both urinary or bowel incontinence? This is the accidental leakage of stool. These are debilitating problems where there is a solution for it, but women don't talk about it. And a lot of times people don't even talk to their primary care physician. So I encourage people who are providers to have this conversation, but then to your listeners who suffer from these issues, please, seek treatment. There is help. And just have that conversation that there are people that specialize in the urinary and bowel issues that people have. And I think it starts with people realizing that, hey, I can't make it to the mall, or, this is the reason I sit in the back of the church to get to the toilet in time. It's these kind of lifestyle changes, or I can't go and visit my grandkids because I'm worried about these accidents. This is where we have a huge impact on keeping people active. And some of the biggest reasons why it happens with the aging process is that some of the biggest reasons people are having to go into nursing homes or assisted living centers is because of continence, both urinary and bowel issues. So there are things we can do to prolong people's independence. Yeah, that's the myth that, oh, that none of these surgeries work or none of these medicines work, and that's just not true. There are ways that we can actually cure incontinence. We can provide therapy. Some of these conditions are more chronic conditions, but there are ways to easily manage them that are very minimally invasive, or even just simple behavioral changes or muscle exercises can really make a profound difference in especially a woman's life. At my level of training and knowledge base for women's health, it can start from the person that just wants to come and, hey, I have accidents when I exercise, or it can be as complicated as people who've had multiple surgeries and have had problems from this or complications. And I think each doctor probably has their own level of expertise that, luckily, being part of a larger health system, we can complement some of our primary care doctors, and we do a lot of education to them, teaching them about these types of functional problems. And then we're a resource for them, and we can help them manage, especially I have a lot of patients that live very, very far away, how we can co-manage those patients to then providing just a resource. And when they kind of said, hey, you know, we've tried these therapies, now it's on to the next step. And this might be after a medication change, it might be after some behavioral changes. I think for me, the importance of if someone is looking to do something surgically or invasive for someone who suffers from issues of incontinence or prolapse, I think those people now, in this time of healthcare and how advanced we've come, they should see a specialist. Our goal is to make lasting effects in terms of their activity level, their interaction with their family members and their communities. And so, you know, what that entails is kind of disease specific, where it could be the young mother that wants to get back to playing in her league volleyball team. Well, that is an easy fix where sometimes either muscle exercises or a simple surgical correction. Or it might be the church elder who wants to get to church and be more active still within the church and going to more meetings, might just need a simple medication. And there's a whole gamut of things. And every treatment really has to be individualized to the person's. What are their expectations? What are their goals? What exactly is wrong? So diagnosing the problem becomes really the main focus. And then we can add treatments to where they can benefit and what specifically helps the problem that we've come up with and diagnosed. So I've been in Sioux Falls for well over 5 years, and I think you've seen a huge change in the community where I think especially in a larger city like Sioux Falls, everything's become very subspecialized. But I think what's benefited the rural communities is having people who have some expertise that go on then to educate them. Their scope of practice expands, and people even living in smaller communities or one-doc towns really have access, and as these larger networks develop, to specialized care and those resources. We're either a phone call away or video visit, or however you want to do it. I think we all work together as a team now, which is kind of the fun part of medicine now. Even though you have someone who's very subspecialized, I'm very dependent on primary care doctors to help manage these patients when they go home or when they get here. And I learn from them just as much as they learn from me in terms of managing ongoing health problems that people have. So I think that's where you see this team approach to medicine has really kind of changed the level of care we're getting, especially in South Dakota, that has greatly improved it. More than adding some subspecialists like urogynecologists, I think it's really the team focus and the team practice that has allowed us to provide better care for especially South Dakotans. There's been a lot of advances in the field of urogynecology. We're still a young specialty, but the fellowships have been around for almost 30 years in some cases. And now there is a specific board we have to take and pass to show knowledge in the field. And we've taken problems where we've had one surgery for a type of incontinence. Now we might have 10 different types of procedures that we can individualize treatment to that person. There's newer therapies such as manipulating the nervous system to control the bowel and the bladder through stimulation of the nerves in the back. We're now using botulinum toxin injection to help relax the muscles to treat overactive bladder. Our surgeries have become minimally invasive, which used to be a 2-3 day stay in the hospital. They're leaving the hospital either that day or overnight. That has helped people recover faster, driven down costs, and we have improved our outcomes in terms of surgical management. And I think with specialized training now, people are getting better care and better outcomes. If you want something new in women's health, urogynecology is what's new. The whole idea that we're treating the pelvic floor in women as one whole unit, what used to be, oh, I had to go see this doctor, I had to see this doctor, I had to see this therapist. There's someone that actually coordinates this area. And we're recognizing not only the difference women have with these types of bowel and bladder issues, but the effects that birth and age have on this area and this region of the body. And now that there's someone who's devoted to this type of field, I mean, we're really kind of revolutionize our approach to people, and more people are getting help because of this, which is really important because a lot of this has to relate to the aging aspect. And this is going to be a huge issue as those baby boomers start moving into an older population and we're meeting the needs of it. So if you ask me if anything was new in the field of women's health, I would say definitely urogynecology or female pelvic medicine.